Using Dragon Medical One has really revolutionized. It's really helped me in the way I practice. During the consultation, I can have a more fruitful consultation, a more rich experience with my patient, not worrying about typing in notes. Previously, I used to have to see the patient within the 10 minutes time, so it was very time challenged. This means that I would have to finish my work later on, at the end of the day or after the patient has left, which then puts me further behind. And if I had to do reports, I had to stay in at least 2 hours per day in order to complete reports for work injuries and insurance companies. Hi, I'm Dr. Kevin Naika, and I'm a general medical practitioner. I've qualified in South Africa at the Nelson Mandela School of Medicine in 1996, and now I am at Michigan Drive Medical Practice located in Southeast Queensland. Besides being the practice principal, I'm responsible for managing this practice. I'm intricately involved in administration, also teaching. We have 8 medical doctors. We practice all aspects of general practice, and my special interest is occupational health. When a patient comes in, it's very important to have a look at them, ask them questions, and interact with them. That is the most important part of the medical consultation, being fully engaged with your patient. This cannot be achieved if you are capturing notes and trying to cram a lot of information into your computer whilst the patient is talking. Dragon Medical Practice Edition was wonderful. For me, it was revolutionary. It helped me to save time and made me far more efficient than I ever was previously. Moving over to Dragon Medical One, it continuously learns new words and updates itself constantly. The most important thing is that it's far more accurate. It has the ability to store your vocabulary in the cloud, and it allows you to use your mobile phone as a power mic. This means that you don't have to be sitting in your office. You can log into your practice software from anywhere, and you could dictate directly into your notes. This system blends seamlessly with best practice, and it's really been a game changer for me. Now, my workload has not decreased, but somehow I am not frustrated and not time pressured. I have Dragon Medical One to thank. During my day, I can dictate notes immediately after the patient leaves. It takes me 1 to 2 minutes to dictate an entire volume of notes to capture the essence of what I have discussed with the patient. During the consultation, if there is a need for a referral to a specialist or allied health, etc., I'm able to dictate all of that into a letter, print it out, and give the patient the referral in that consultation. There is no need for the patient to come back. There's no time lag. The same applies with telehealth. When I am talking to the patient on the telephone, I can dictate referrals and send them through medical objects or other software directly to the specialist. The consultation becomes more fruitful and complete. And if I have notes or reports to do, I can go off home and do it remotely. Some reports require a lot of thinking and assessment and analyzing, and Dragon Medical One allows me to dictate these complex reports in a fraction of a time. The introduction of Dragon Medical One is probably one of the best things or best decisions that I've made. It has really lightened my burden in private practice. I can do reports in a fraction of a time. That improves my cash flow. My admin staff are exceptionally happy that I do not burden them with reports, or they have to do my work instead of their work. And I get time to go home, spend time with my family. So it's really a breath of fresh air. Voice Recognition Australia will get 10 out of 10 from myself. The overwhelming support. I was happy to start the program, and as I went along, the support was there to improve my understanding and knowledge and appreciating the higher functioning of this program, which is brilliant. I wouldn't go anywhere else.